Hello, and welcome to our channel, where we explore natural ways to boost your health and wellness. Today, we're tackling a very common but often misunderstood issue: dental plaque and tartar. Many of us think they're the same thing, but there's a crucial difference. And knowing it is the first step toward a healthier smile. So, what is plaque? Imagine a sticky, colorless film of bacteria that constantly forms on your teeth. It's made up of food particles, saliva, and, of course, bacteria. This is plaque. If you've ever felt that fuzzy coating on your teeth when you wake up, that's it. It's the primary cause of many oral health problems, including cavities and gum disease, because the bacteria and plaque produce acids after you eat or drink. These acids can attack your tooth enamel, leading to decay. Now, what happens if you don't remove this plaque regularly? It hardens. When plaque mixes with the minerals in your saliva, it calcifies and turns into tartar, also known as dental calculus. Unlike plaque, which you can remove with good brushing and flossing, tartar is a hard, crusty deposit that can be yellow or brown. It bonds strongly to your tooth enamel and can even form below the gum line. Tartar makes it harder to brush and floss effectively, creating a breeding ground for more plaque and leading to more serious issues like gum inflammation or gingivitis, and eventually periodontitis. This is why removing both plaque and tartar is absolutely essential, not just for a bright smile, but for your overall oral health. While regular dental checkups are non-negotiable for dealing with hardened tartar, there are several effective home remedies you can use to manage plaque and prevent tartar from forming in the first place. Today, we're going to dive into the best natural methods you can start using right away. Let's start with the #1 home remedy that people have trusted for generations: baking soda. You might have a box of it in your kitchen for baking, but it's also a powerhouse for oral hygiene. Why is it so effective? It comes down to two key properties: its mild abrasiveness and its ability to neutralize acids. First, let's talk about its abrasive nature. When you use it to brush, these tiny particles gently scrub the surface of your teeth, physically removing the sticky film of plaque without being harsh enough to damage your enamel. Think of it as a gentle exfoliant for your teeth. It's effective at lifting away stains and plaque before they get a chance to harden into tartar. The bacteria in your mouth thrive in an acidic environment. They feed on sugars and starches, producing acids that erode your tooth enamel. Baking soda is alkaline, meaning it has a high pH. When you introduce it into your mouth, it helps neutralize these harmful acids, creating a less hospitable environment for bacteria to grow. This doesn't just help prevent cavities, it also helps combat bad breath caused by these same bacteria. So, how do you use it? It's incredibly simple. You can make a paste by mixing about a teaspoon of baking soda with a few drops of water until it has a toothpaste-like consistency. Then, dip your toothbrush into the paste and brush, as you normally would, for 2 minutes. Focus on all surfaces of your teeth. You can do this a couple of times a week. Some people also like to add a pinch of baking soda to their regular toothpaste for an extra cleaning boost. However, because it is abrasive, it's best not to use it every single day. Moderation is key. Now, let's move on to another powerful technique: oil pulling. This ancient Ayurvedic practice has been used for centuries to improve oral health and has gained a lot of popularity recently. The concept is simple. You swish a tablespoon of oil in your mouth for about 15 to 20 minutes. The most commonly used oils are coconut oil, sesame oil, or sunflower oil, with coconut oil being a favorite due to its pleasant taste and antimicrobial properties. How does it work? The bacteria in your mouth are single-celled organisms, and they also have a lipid membrane. As the saying goes, like dissolves like. When you swish the oil around your mouth, the lipids in the oil are thought to attract and pull the bacteria from the surfaces of your teeth, gums, and tongue. Essentially, you're pulling them out. After swishing, the oil is filled with bacteria and toxins, so it's very important to spit it out into a trash can, not to sink, as it can clog your drain over time. Studies have shown that oil pulling can significantly reduce the amount of plaque-causing bacteria in the mouth. For example, coconut oil contains lauric acid, which is proven anti-inflammatory and antimicrobial effects. This means it can help reduce plaque buildup and soothe inflamed gums, which is a common symptom of gingivitis. To try oil pulling, take 1 tablespoon of a cold-pressed oil, like coconut oil, first thing in the morning on an empty stomach. Swish it gently around your mouth, pulling it between your teeth. Try to do this for 15 to 20 minutes. It might feel like a long time at first. So we start wheat, 5 minutes, and work your way up. After you spit it out, rinse your mouth with warm water and then brush your teeth as usual. It's a fantastic way to supplement your daily brushing and flossing routine. Another supporting remedy worth mentioning is a hydrogen peroxide rinse. You've probably used hydrogen peroxide to clean a cut, and its disinfectant properties can also be beneficial for your mouth. Hydrogen peroxide is an oxidizing agent, which means it releases oxygen molecules that can kill anaerobic bacteria of the kind that thrives in low oxygen environments, like under your gums. Using a hydrogen peroxide rinse can help reduce plaque and relieve minor gum inflammation. It's particularly effective at killing the bacteria that cause you. To make a safe rinse at home, you must dilute it properly. You should only ever use a 3% food-grade hydrogen peroxide solution, which is what's commonly sold in pharmacies. Mix 1 part of the 3% hydrogen peroxide with 2 parts water. Never use it undiluted, as it can burn your gums and damage your enamel. Swish this mixture in your mouth for about 30 to 60 seconds, then spit it out completely. Be very careful not to swallow it. After spitting it out, rinse your mouth thoroughly with plain water. You can use this rinse 2 to 3 times a week, but it's not recommended for long-term daily use without consulting your dentist, as overuse could potentially irritate your oral tissue. It's fantastic to have these powerful home remedies in our toolkit. Baking soda, oil pulling, and hydrogen peroxide rinses can do wonders for managing plaque and keeping your gums healthy. They are excellent preventative measures that you can incorporate into your routine to maintain a clean and healthy mouth between dental visits. However, and this is the most important takeaway from today's video, it's crucial to understand their limitations. While these remedies are great for controlling soft plaque, they are not effective at removing hardened tartar. Once plaque has calcified and turned into tartar, it forms a very strong bond with your teeth that couldn't be scrubbed off with a toothbrush or dissolved by home rinses. Trying to scrape it off yourself with sharp objects is extremely dangerous and can cause permanent damage to your tooth enamel and gums. The only safe and effective way to remove tartar is through a professional dental cleaning. Your dentist or dental hygienist uses special tools, like ultrasonic scalers and hand instruments, to carefully and precisely remove tartar deposits from your teeth, both above and below the gum line. This procedure is called scaling. Think of it this way. Your daily home care routine is your first line of defense. It's like daily housekeeping for your mouth. But every 6 months or so, you need to call in the professionals for a deep clean. Regular dental checkups allow your dentist to remove any tartar that is accumulated and to spot any potential problems early on before they become serious. So, please, use these wonderful home remedies to keep plaque at bay. But never skip your professional dental cleaning. They're an essential part of maintaining not just a beautiful smile, but your overall health. Thank you so much for joining us today. We hope you found this information helpful and feel empowered to take better care of your oral health. If you enjoyed this video, please give it a thumbs up, and don't forget to subscribe to our channel for more health and wellness tips. Let us know in the comments below if you've tried any of these remedies, or if you have any questions. Stay healthy, and we'll see you in the next video.